my name's Kelly. I'm calling from the City of Bloomington Public Health Division. So contact tracing is the process by which we contact people who have tested positive for COVID-19, get information from them, and then find people that they may have exposed while they were infectious in order to stop the transmission of disease.
Positive tests are reported to the Minnesota Department of Health, who pass that information to local public health divisions.
Here at Bloomington Public Health, we handle cases who live in Bloomington, Edina, or Richfield. So if a case from Bloomington, Edina, or Richfield comes through through MDH, they inform us, and then it's put into a queue on a computer system so that we can call that person. So every day we get a list of people who we need to call or who we haven't reached yet and call them to try to do interviews. First, I want to start by asking, it looks like you did a COVID-19 test last Tuesday. Contact tracing and isolating and quarantining people who've been exposed or sick is one thing that we know we can do to stop the transmission of COVID-19. It's effective to keep people at home who are infected but don't know it. And especially since so many people we've been finding are asymptomatic but can still give it to other people, calling people's contacts who might not feel sick at all and making sure that they're staying home is a way to stop them from spreading COVID-19.
Being empathetic is one of the most important tools to collecting accurate and timely information.
When we call people who've tested positive with COVID-19, it's important to have a level of empathy and rapport with them. If they've just been diagnosed, they probably aren't feeling well physically, they probably aren't feeling well mentally, they've just been told maybe from the doctor that they can't go back to work for a certain amount of time, they're worried about being able to pay their bills, they're worried about their family members who they might have infected, and they're worried about what happens now. So it can be a little scary when we call to have someone from public health calling and asking all these questions.
Nos acaban de informar que usted ha tenido un test positivo el virus coronavirus 19.
Being able to communicate clearly with those who speak languages other than English is also key.
So using interpreters or people at public health is a way to make sure we are being accessible to those people and providing them with the same level of care that we would provide to everyone else.
Interpreters are on hand to serve and speak with all members of the community.
We know from data that we're seeing from people who have tested positive with COVID-19 that statewide and in Bloomington, people of color are being affected more strongly than cases who are white or non-Hispanic. So since they are being affected so much more disproportionately and that there are so many people who have tested positive in those communities, it's important that we have resources on hand to be able to provide them service and to be able to provide it in a timely manner.
Connecting people with local resources.
I was feeling like I wasn't helping because she was crying so much, but I say, try this, try this, try this. At the end, she kind of started feeling good about everything, but we try to give all the resources we can.
Some people don't answer the phone when we call, they don't return our voicemails because they don't know why we're calling or who we are. It's important for us to reach these people for a couple reasons. First of all, we can help them. We can provide them resources for things like food assistance and so on. We can answer questions that they might have about the specifics of their isolation period. And we can provide them with phone numbers that are staffed 24/7 for them to call with any questions or concerns. They also help us in terms of giving us information that we can use in public health to help stop the chain of transmission of COVID-19 through the communities. And most importantly, by participating in these phone calls, people are helping their community. They're helping people stay healthy and safe by stopping the chain of transmission of COVID-19.